Welcome back. A new international study suggests millions of breast cancer patients could safely avoid chemotherapy. Researchers have developed a DNA test that detects which patients can benefit from the treatment.
Dr. Farin Amersi is a breast surgical oncologist at the Cedars-Sinai Medical Center, and she's here with us live to talk about these early trials. I think this is, you see the headline of this, and for people who have either had breast cancer or had people in their family who had breast cancer, what a huge development.
Yes. Thank you for having me, first of all. And absolutely, this has been one of the biggest trials in breast cancer that was done in the United Kingdom. And it was a trial looking at patients who truly are considered high risk, meaning large tumors, had cancer that had spread to their nodes, and standard is to give them chemotherapy. They used a test called Prosigna, which looks at actually genetics, or the genes within a cancer, to determine whether the expression of genes put patients at higher risk of cancer in the future, and more importantly, if chemotherapy was beneficial. Using that test, so these are women who otherwise would get chemotherapy.
Right.
They stratified them into, based on the Prosigna test, to not get chemotherapy. Women who otherwise would have been given chemotherapy.
Right.
And they looked at these patients, over 4,400 women, and they compared them to women who got chemotherapy, and the outcomes were exactly the same.
Oh, wow.
So women could safely avoid chemotherapy now as a result of tests like Prosigna. In the US, we have a test similar to that called Oncotype that looks now not just at under the microscope looking at breast cancer, but really genetic genes expressed by the cancer that's going to help predict the future. That's going to help predict more from a personalized standpoint whether chemotherapy is truly beneficial to these patients or not.
Absolutely, because chemotherapy can be so harsh on patients.
Correct.
So if this test says the person wouldn't benefit from chemotherapy, then what kind of treatment are they getting?
Sure. So it's specifically for hormone-positive breast cancers, where there's options of chemotherapy and then there's hormone therapy, not hormone replacement, but hormone therapy. They're hormone blockers, which are pills instead. So we know that chemotherapy has side effects of nausea, hair loss, fatigue, lowers your immune system, causes numbness of your hands and feet, right? So you're getting chemotherapy that you might not need and have those horrible side effects. Now there's actually pills instead, so it's not that they wouldn't get any treatment. Instead, they would be taking an anti-estrogen pill for 5 years to prevent the cancer from coming back.
So there's a lot of debate about hormone replacement therapy.
Yes.
You just said estrogen.
Hormone blocker.
Yes. So talk about that a little bit, because I think people may get a little confused.
Absolutely. So there's hormone replacement therapy, which is when women go into menopause and have side effects from going into menopause. So that's hormone replacement therapy. That is actually taking estrogen and progesterone. There are breast cancers that do express estrogen, meaning they thrive on estrogen. So when you're diagnosed with a estrogen positive breast cancer, we want to cut down the estrogen production in your body. So if you're on hormones, we stop you from taking them. And more importantly, then you're put on a hormone blocker. And those hormone blockers, they're called anti-estrogen pills, are so powerful that nowadays, instead of chemotherapy for some women, it actually works better at preventing cancer from coming back.
This is fascinating.
It is really interesting. Did the study identify a particular type of woman or a particular type of breast cancer that would be most likely to not need chemotherapy and the woman still be fine?
Sure. So the study specifically looked at a subset of breast cancer, which were the hormone-loving breast cancers, the estrogen-positive breast cancers, not the estrogen-negative ones. Estrogen-negative breast cancers, you do have to get chemotherapy. There's no pill to give you. So the reason this study was done is because there is an alternative to chemotherapy. There's the pill, right? The anti-estrogen pill. So these women were not given nothing once that Prosigna test was done that showed their risk was low and chemo would not benefit them. They were then put on the anti-estrogen pill, and their outcomes were exactly the same as women who got chemotherapy for the same type of cancer.
Can we talk about breast screening?
Sure.
Because I think that's also something that has changed in terms of you get a mammogram at 40, then 45 for what the recommendations seem to kind of move around.
Yes.
So can you talk about what should women be talking to their doctor about with something like this?
Sure. So it's absolutely true. There's been a lot of studies in the past that have said don't do it before 40 to 50. You could do it every 2 years. Starting at 50, do it. Standard is an average woman who is at low risk of getting breast cancer, meaning no family members, you should be getting a screening mammogram every year starting at 40. That's standard of care. And if you have questions about whether you should be getting screening, how should you talk to your doctor about it? The American Cancer Society has a great campaign, which is the I Love You, Get Screened campaign. So you can call them, they can tell you where you can get screening done, how to navigate insurance, how to bring it up to your doctor. But the standard is at 40, you should be getting an annual mammogram. Women who have dense breasts can also get screening ultrasounds as part of it. And then obviously, if you're high risk, I think that's the biggest thing is, are you at higher risk than the average woman? And there's now genetic testing available. And if you test positive for a high risk gene, such as a BRCA gene, then you should be getting MRIs in addition to mammograms. But standard is at 40, it's every year.
Yeah, definitely got to talk to your doctor about your specific circumstances. But thank you so much for being here. This study really seems groundbreaking and hopefully will help a lot of women.
Thank you for having me.
We appreciate you.
Thank you. All right, let's get a check now of our next weather forecast with Marina Jurica.